You wake up with your heart beating fast, maybe a little dizzy when you stand. And quietly, you ask yourself, am I going to be okay today? I've heard this story many times. Most of my patients, men and women over 60, believe they need medication to manage their blood pressure. They're told it's just part of aging. But here's what I've seen in over 20 years of practice. That's not the whole truth. Yes, medication can help, but it's not the only answer. In fact, many people are able to lower their blood pressure naturally without pills by making gentle changes in how they eat, move, and breathe. Real changes, real results. In just 7 days, some of my patients have lowered their blood pressure by 10 to 15 points. And they felt more energy, slept better, and had peace of mind again. That's why I made this video. To share a simple, science-based 7-day plan that can help you do the same. I'm Dr. Sarah Bennett. I've helped thousands of people over 60 improve their health naturally and safely. And if you're ready to take that first step, you're in the right place. The problem of high blood pressure and its serious consequences. High blood pressure is often called the silent killer, and for good reason. It doesn't hurt. It doesn't cause a rash, a cough, or a fever. You can feel perfectly fine, until one day you're not. I've seen it time and time again, patients in their 60s, 70s, even 80s living their lives, unaware that their blood pressure has been quietly rising for years. Until something serious happens. A stroke. A heart attack. Kidney failure. Or a sudden loss of vision. And it all traces back to that one number, blood pressure. High blood pressure puts strain on every part of your body. It forces your heart to work harder. Over time, this can lead to heart failure. It damages the tiny blood vessels in your brain, raising your risk of memory problems and stroke. It reduces blood flow to your kidneys, leading to gradual kidney damage. It even affects your eyes, sometimes causing vision loss. What makes it worse is that most older adults don't know it's happening. They go years without checking their blood pressure regularly. And by the time they start medication, the damage may already be underway. Medication can help, but it often treats the symptom, not the source. It lowers the number on the monitor, but it doesn't rebuild the health of your arteries. It doesn't reverse the years of stress, inflammation, or poor circulation. And sometimes it leads to side effects like fatigue, dizziness, or cold hands and feet, especially in older adults. That's why I believe so strongly in helping patients take a deeper look. Because behind that quiet number on the screen is a much bigger story. And unless we address the root cause through daily habits and lifestyle changes, we're only trimming the weeds, not pulling them out. High blood pressure is common, but it is not untouchable. There's more you can do naturally, gently, and with lasting impact. Breaking the misconceptions. For many people over 60, there's a common belief that once you start taking blood pressure medication, you're on it for life. But that's not always true. Not every case of high blood pressure requires a lifetime of pills. In fact, for many older adults, the root cause isn't their age, it's their daily habits. And that means there's something you can do about it. Through decades of working with seniors, I've seen blood pressure drop not from medication alone, but from meaningful, consistent changes in 3 simple areas: what you eat, how you move, and how you breathe. Nutrition, movement, and breathing, these aren't just wellness buzzwords. They are powerful tools backed by science. Studies show that increasing potassium-rich foods like leafy greens and cutting back on sodium can lower blood pressure as effectively as a mild prescription drug. Walking for just 15 minutes after meals has been shown to improve circulation and regulate blood pressure. And slow, mindful breathing, just 5 minutes a day, can activate your body's relaxation response, reducing stress hormones that raise blood pressure. This is not guesswork. It's proven. The body responds quickly when you give it the right support. That's why I've created a 7-day plan. It's simple, safe, and focused on exactly these 3 areas. Each day, you'll have small steps to follow. Nothing extreme, no special equipment, no expensive supplements, just natural, easy-to-do actions you can take from home. We start with gentle detox. Then, we'll stimulate healthy circulation. And by the end of the week, we'll help reset your blood pressure response. It's not a miracle cure, but it's a powerful beginning. And for many people, it's the turning point they've been waiting for. Your journey to lower blood pressure naturally can start today, and I'll be here to walk you through it. Before we dive in, remember this simple truth. Small, steady shifts can create powerful changes. Over the next 7 days, we'll walk together through gentle, natural steps that support your heart and gradually lower your blood pressure. We'll begin with a light detox to help your body let go of extra sodium, reset its balance, and prepare for the days ahead. Day 1-2. Gentle detox. Think of these first 2 days as a soft reset, no harsh cleanses, no extreme diets. Morning ritual. Start each day with a warm glass of water and a few lemon slices. It hydrates, aids digestion, and nudges your liver and kidneys into gentle detox mode. Trim the salt. Hidden sodium in canned soups, deli meats, frozen meals, and sauces makes your heart work harder. Aim to keep daily sodium under 1,500 milligrams by favoring fresh foods and seasoning with herbs, garlic, and lemon. Add potassium-rich produce, leafy spinach, creamy avocados, sweet bananas, tender white beans, vibrant tomatoes, bright oranges, and roasted sweet potatoes all help ease tension in your vessel walls. You don't need to overhaul everything at once. Even these small tweaks start reducing fluid retention and vascular stress almost immediately. Day 3-4. Activate circulation. With excess sodium flushing out, it's time to wake up your blood flow. Post-meal walks. After each main meal, enjoy a relaxed 15-minute stroll around the block, through your garden, or even inside your home. This simple habit steadies blood sugar, aids digestion, and keeps arteries flexible. 5 minutes of deep breathing. Before the day gathers speed, sit comfortably. Inhale through your nose for 4 counts, hold for 2, then exhale through your mouth for 6. This calms stress hormones and tells your heart, you're safe, slow down. Nourish with garlic and beets. Allicin in garlic and natural nitrates in beets relax vessels and boost circulation. Try roasted beets at dinner and a touch of raw garlic in salad dressing or sautéed veggies. These modest moves speak directly to your heart and vessels, encouraging smoother, stronger flow. Day 5-6. Repair your blood vessels. Now that circulation is humming, we'll strengthen the vessel walls themselves. Breakfast boost. Stir 1 to 2 tablespoons of chia or flax seeds into oatmeal, yogurt, or a smoothie. Their omega-3s and fiber calm inflammation and keep arteries supple. If you're new to seeds, let them soak briefly to aid digestion. Mindful caffeine. Enjoy your morning coffee, but skip caffeine after 2 p.m. Late-day stimulants can raise blood pressure and disturb sleep, both stressors for aging vessels. Choose soothing herbal teas like chamomile or hibiscus instead. Evening foot massage. Before bed, spend 5 to 10 minutes massaging feet and calves with warm lotion or olive oil. Gentle upward strokes relax muscles, improve venous return, and set the stage for restful sleep. Each of these quiet acts nourishes the pathways your blood travels every second. Day 7. Reset and reflect. You've reached the final day of this first week, and your body is already shifting quietly but powerfully. Check your blood pressure in the morning before breakfast or medication. Compare it with day 1. Even a 5-point drop is meaningful. Notice how you feel. Is your sleep deeper, mood lighter, breathing easier? These subtle signals reveal real progress. This week wasn't a quick fix, it laid a new foundation. Keep using these natural, proven tools each day, and your body will continue whispering, "Thank you, I know how to heal." You don't have to live in fear of your blood pressure anymore. Too many people over 60 wake up each day worried about the numbers, the pills, the side effects, and what might happen next. But as you've seen in this video, there is another way. A gentler, more natural path. And it starts with just one small step. I invite you to take the 7-day challenge. Follow the simple daily actions we've outlined. No pressure, no perfection, just steady, loving care for your body. You may be surprised by how quickly your body responds. By day 3, you might sleep better. By day 5, your energy may lift. And by day 7, your blood pressure might be lower than it's been in years. Let this week be the beginning of something better, because you deserve to feel calm, strong, and in control. If you're ready to begin, start today. And I'd love to hear from you. What's your current blood pressure? Share it in the comments below, and let's support each other in this journey toward better health. You are not alone. And the best time to begin is right now.